Rural and remote healthcare service delivery in Papua New Guinea. Papua New Guinea's beleaguered healthcare system ranks among the worst in the Pacific and the entire world when it comes to providing basic services and achieving decent health outcomes. The situation is most dire in the nation's widespread rural and remote areas, home to the vast majority of PNG's population. Lack of funding, infrastructure deficits, and medical staff shortages have created a preventable but ongoing crisis. The facts are staggering. PNG has an infant mortality rate of 46 deaths per 1,000 live births, a maternal mortality ratio of 145 deaths per 100,000 live births, and a life expectancy of just 65 years. These figures are multiples worse than developed nations. Malaria, TB, HIV, AIDS, and other infectious diseases remain widespread killers due to lack of prevention, screening, and treatment. An estimated 80% of PNG's rural population lack access to basic primary healthcare services. At the heart of this calamity is chronically low government funding for healthcare, hovering around just 3.1% of GDP. This pales in comparison to the 5% minimum recommended by the World Health Organization. Lack of funds starves rural clinics of supplies, equipment, staff, electricity, and other essentials. Data from the World Bank shows PNG is just 0.5 physicians and 5 nurses, midwives per 10,000 population, far below levels needed to adequately serve the population. Village health workers often go unpaid for months or years at a time. PNG's crumbling health infrastructure is also ill-equipped to serve its dispersed rural populace, the majority of whom live in hard-to-reach areas. Only around 20% of the population lives within 5 kilometers walking distance of a health facility. According to UNICEF data, many villagers must undertake multi-day treks over treacherous terrain to reach provincial hospitals. Supply chains are in disarray, causing chronic shortages of essential medicines, vaccines, diagnostics, and other supplies at rural facilities that are operational. To rectify this unfolding tragedy, PNG must urgently prioritize rebuilding and reinforcing its rural health care capacity. Through increased funding, staffing, infrastructure development, and deployment of health services, government health expenditure must be immediately doubled from 3.1% of GDP to at least 6%. In line with WHO guidance, this would provide over $300 million in additional annual funding based on PNG's current GDP. These funds should focus on recruiting, training, and deploying thousands of new community health workers to serve rural areas through mobile outreach and clinics. Existing rural facilities must receive reliable electricity, equipment, supply chains and communications, transportation links. Stockpiles of vaccines, antimalarials, antibiotics, antiretrovirals, and other essentials need bolstering. Maternal, neonatal health services must expand through additional staff, facilities, and education programs. Air transport and telehealth capabilities are vital for reaching the most isolated populations. Without such drastic measures and budget prioritization, PNG's rural health care calamity will only deteriorate further, consigning more of the populace to utterly preventable suffering and death. The solutions and funding required are evident. What remains urgently needed is the political will to finally begin addressing this long-standing crisis. The human cost of further negligence are simply unacceptable for a crisis of this scale. PNG's people deserve far better health care access and outcomes than what they currently face.